Hey, this is Kit Cabello of Harlens Media. We're here at UIC covering the Democratic Socialists of America convention here in the city of Chicago, and I'm joined here today with John Hieronymus. John, thank you so much for joining Harlens Media.
Thank you for having me for an interview.
No problem. So, when we were getting set up, you were definitely talking about why you're here supporting this convention. Why do you support the DSA and this convention happening here?
I support DSA and the convention happening here because this is the largest gathering of socialists in the history of the last 20 or 30 years. DSA has experienced explosive growth. We've gone from an organization of 6,500 people to just under 25,000 members over the last year. So there's been a lot of exciting changes that have been happening within the organization, a lot of new members coming in, a lot of new energy, and there are a lot of questions that we need to answer.
It's quite clear that this organization has grown in strength and power and will definitely have a voice to say during the 2018 and 2020 election cycles. But there's one issue that's really being brought up a lot, and that's health care here in the United States. Recently, John McCain voted yes to a debate for health care or getting rid of the Affordable Care Act here in the United States, and then he was the crucial vote that said, no, we are not going to get rid of the Affordable Care Act. What are your thoughts on our current healthcare here in the United States, and do you think that we could possibly move to single-payer healthcare?
Well, I'm a nurse at University of Chicago and in a union, and single payer has been something that I've always thought is achievable in the United States. Single payer healthcare is the global model for providing health care in an industrialized, wealthy country like the United States. It's just that we've been propping up this fantasy that markets can provide adequate health care at an affordable price for all of its people. And I think that the recent campaigns on the Republican Party's part to dismantle the Affordable Care Act have really shown that you can't get any further to the right than the Affordable Care Act in terms of health care delivery. It was designed essentially by the Heritage Foundation as a counter to the Hillary care plan that was put forth in the mid-90s. And Mitt Romney pulled it together in Massachusetts as kind of a model. And ultimately, it's a lot of subsidies to insurance companies. It preserves all the market-based mechanisms for a lot of people in the United States who weren't being insured before but now are being offered insurance that they can't really afford. And ultimately, to go further to the right, you basically have to destroy the foundations and fabric of how healthcare is delivered in the United States.
Now, you being a nurse, you've definitely seen a lot of people come in and out of the hospital, some under light care or under real intensive care, and it can be argued that one bad day and an average American is destroyed financially due to the bills that they have to pay. However, critics of single-payer healthcare say that it can't be done here in the United States. What are your thoughts on that?
Well, I think right now that people are seeing the polling for Medicare for All, which is essentially single-payer health care in the United States. It's Medicare that's been fixed and extended to everyone in the U.S., is actually now has bipartisan support amongst the population in the United States. It's not unusual to see left positions being, the American populace taking left positions far more to the left than their politicians are willing to do. I think that we're getting to a point where healthcare is becoming so expensive and so difficult to administer across our current system that there will be a crisis in our healthcare system regardless. The Affordable Care Act managed to stave it off for maybe another 5 or 10 years tops, and that we will have to come up with a solution to providing healthcare to everyone in an affordable and equitable way in the United States.
Now, there are many groups that have different points of view on how healthcare should be implemented here in the United States. There's Green Party, Libertarians, Socialist Alternative, and I know that DSA right now is not a political party. It's just a political organization, and it's growing in strength and number. But there's also different factions here, like, for example, the Libertarian Socialist Caucus. what would be their plans in regards to healthcare in the United States, and how would it differ from, let's say, a libertarian point of view?
Sure. So my understanding of libertarian provision of healthcare would be completely market-based, and where you basically make all healthcare transactions totally transparent. So the idea is that you're shopping for your knee replacement surgery like you would shop for a muffler replacement or any other, like, shopping for someone to roof your house. The problem is that was the healthcare delivery model the United States had in the 1870s, and it failed. And that's why we came up with insurance. As a libertarian socialist, I think that healthcare provision in the United States currently is a way for employers to tie their employees into like an oppressive system where they can't make choices because they're forced to stay at current areas of employment, or else they'll lose their health care. A libertarian socialist such as myself would look at our healthcare system and say we need to come to this with a socialized system where everyone has the freedom to go to see whatever doctor they want to see, to go to whatever hospital they want to go to or clinic they want to, and ultimately their ability to maintain their health isn't tied to an employment contract or how much money they have in their pocket. And we see it as a way of liberating working people, so that if, let's say, you wanted to start a small business, but you haven't been able to start a small business because you're afraid you're going to lose your health care plan, well, if you have access to a socialized system of healthcare delivery, you can go make that decision, and it's your freedom now.
And that's an interesting perspective to see it. But in regards to LSC, this is a unique kind of thing, because you're seeing two different ideologies come together and build a coalition. Essentially, can this large coalition, I'm not only including the LSC, DSA, but other groups, can they effectively unite and propose a real political challenge to the two-party political establishment system as we enter closer to the 2018 and 2020 election cycle? Of course, there's a lot of talking and debates that need to be done, but can it be effectively done, in your opinion?
Well, I think that currently the electoral prospects for DSA broadly, and Libertarian Socialist Caucus within DSA, currently we're still very small. We're still weak, but we're still growing. And one of the things that we can do is help come up with new ways of messaging about healthcare and how it is that it relates to the political situation. I don't think that the Democratic Party right now, with their current message and their current leadership, is willing to take the jump to support something as popular as Medicare for all. I think that they are unwilling to make that jump because they are bought and paid for by the insurance industry, by healthcare delivery CEOs, and these interests are keeping them from taking what's essentially a very popular position. Our job is to, and my job as Libertarian Socialist, is to help DSA incorporate the language and rhetoric of freedom in the in the United States to the healthcare fight, so that we're not just talking about, oh, everything is going to be more equal, but we're also talking about it's not only going to be more equal, but it's also going to be freer, and that it will provide you with a lot more personal choice and autonomy that you don't have anymore as a working person.
Okay. And final question. Where can our viewers and subscribers learn more about LSC, and perhaps if they want to help volunteer, where do they have to go to on social media?
Well, anyone who wants to join DSA can go to Democratic Socialists of America, their website, USA.org, or the Libertarian Socialist Caucus in particular. We're on Facebook, or DSA LSC on Facebook.
All right. Thank you so much for joining Hard Lens Media, and to all our viewers and subscribers, peace, everyone.